A study of almost 800 children followed over several years shows that those who get the fewest hours of sleep are at greatest risk of developing psychiatric difficulties later, including ADHD, anxiety, and depression. Boys who sleep fewer hours have an increased risk of developing behavioral issues. Both girls and boys who get less sleep are at greater risk of future emotional problems. The measurements do not indicate anything about the quality of sleep. Children's sleep was measured with motion sensors every night for a week. The researchers conducted clinical interviews to measure mental health difficulties. These procedures were repeated several times every 2 years. The study also investigated whether psychological difficulties might cause children to sleep less. The data do not indicate this to be the case. Sleep duration influences the risk of later problems, not the opposite. The study shows that the children who sleep fewer hours than others more often develop psychiatric symptoms even 2 years later. The researcher emphasizes that big individual differences exist when it comes to how much sleep each child needs. What amounts to too little sleep for one child may be more than enough for other kids, so parents shouldn't worry unnecessarily either. The researcher says it is difficult to give advice that fits for all families and all children. But having a consistent wake up time in the morning is perhaps the most important way to develop healthy sleep habits. Children who were getting too little sleep when they were 6 years old did not necessarily suffer from a lack of sleep when they got older, with most of them meeting the recommended sleep duration. But if insufficient sleep started later, at age 10 for example, the habit tended to persist. Fewer of these children outgrew their insufficient sleep patterns as they got older.